Hi guys and welcome to another video. In this video we're going to talk about cardiac arrests and heart attacks. This is going to be an interesting one, so let's dive right in. Okay, so first off, what are cardiac arrests and what are heart attacks? Are they the same thing? Well, no. Many believe that cardiac arrests and heart attacks are the same thing. However, while a heart attack can lead to a cardiac arrest, in many cases it doesn't. At the base of it, a heart attack is a circulation problem, while a cardiac arrest is an electrical problem or a rhythm disorder, you can say. Okay, so let's start with a cardiac arrest and try to understand what exactly is it. Okay, so as mentioned, a cardiac arrest is an electrical problem or a rhythm disorder. And right now we're at the American Heart Association official website, and we're going to compare how a normal heart rate looks like compared to the cardiac arrest. So right now we're looking at the normal heart rate. In this representation, it is beating 60 beats per minute, which is within the normal range. And if we look at the graph here, we will see that this is exactly how we expect that it should act, that it should be. This yellow thing represents the electricity that it is in our heart. So you can see the electricity pulses that making it contract. Now, if we switch to cardiac arrest, we will see that the heart is basically arrested in place. It is still technically beating, but it has lots of different electrical pulses that are making it contract. And so if we look at the graph, then the beating is not effective. This is basically how a cardiac arrest looks like. Cardiac arrest can happen by many different things. The main causes are usually heart attacks or a lot of different heart diseases and heart conditions. However, they can also happen because of an electrocution, of a drug overdose, or of a really big change in the oxygen levels in the body. So for example, from losing a lot of blood or from hypoxia. For example, like the drowning CPR video we saw earlier. Okay, now for the treatment. The way we treat a cardiac arrest is already, as we learned, with CPR. Now, it's important to mention, our goal with CPR is to sustain our patient. We're trying to make sure that he survives until he can get more advanced medical treatment. However, in the first few minutes of a cardiac arrest, it is still possible to revive him. So we should keep this in mind. If we perform CPR immediately, and especially, and this is important, especially if we use an AED effectively and pretty fast, pretty quickly, then we might revive him. So it is very important to take action as well as being quick about it. Okay, now let's talk about heart attacks. As mentioned, a heart attack is a circulatory problem. A heart attack happens when one of the heart arteries gets partially obstructed or completely blocked. This usually happens because of plaque, which is a fatty substance that can slowly build up in our arteries. The buildup of this plaque will lead to a narrowing in our heart arteries, which may create a blood clot that will further narrow or even completely block our artery. This blockage of blood flow will cause damage to part of the heart muscle. This is what we call a heart attack. Okay, keep in mind, once the artery is blocked, it will create different symptoms. The main symptom that we know is chest pain or chest discomfort. However, it's not always just about the chest. This pain can also spread to our neck, to our jaw, to one of the arms, to both of the arms, in some situations to our back. It can also create stomach discomfort. It might feel like our stomach isn't digesting properly. It can create breathlessness, which means that we're feeling like we need air, we need to take air. Sometimes we will be gasping for air. And this usually happens even before we feel the chest pain. And also, we can become very weak, we can have nausea, we might even vomit, and we can obviously be in a really panic situation. We might feel as if something bad is about to happen. Now, if we look at someone who is having a heart attack, we will see that he is pale, that he is sweating. We will see that he might be gasping for air. It depends on the situation. And that he is weak, and he might even collapse and lose his consciousness. Now, it is very important to mention, not all patients will have all signs. Some patients might mainly feel chest pain, while others might feel back pain and nausea. It is really important to mention this. The main symptom is usually chest pain for both men and women. However, recent studies have proven that women are more likely to experience the different symptoms more than the chest pain. So there were actually a lot of times where women weren't treated for heart attack because they complained more about jaw pain, stomach pain, back pain, and all of the other symptoms. And the doctors didn't realize that they're having a heart attack. So it is worth keeping this in mind. Okay, now for the treatment. The treatment for heart attack is fairly straightforward. First thing we would want to do is to call for an ambulance. We want the help to come as fast as it can, so our heart or our patient's heart will not receive too much damage. So it will be easier for the doctors to help our patient. Second thing is, if our patient is not allergic to aspirin, it could be a good idea to give them to chew 300 mg of aspirin. It would be very good if we tell them to chew it instead of immediately swallow it, because then it will get to their bloodstream faster. And the reason why we do this is because aspirin helps make the blood thinner. And so it might, if it's partially blocked, more blood will get to the heart, which might ease the situation. After that, it could be a good idea to calm our patient. If our patient can focus on their breath and will take deep breaths and he will calm down, then his heart will have less workload. It will beat not as fast, and he would feel better. And lastly, we should monitor their situation until the ambulance arrives. In some situations of heart attacks, they will lead to a cardiac arrest. I must say, not in all cases. Usually it doesn't, but it is very important that we will be prepared to perform CPR, and also that we will not perform CPR on soft things. So for example, if our patient is sitting on a couch or is lying on a bed, we will first make sure that we lie him on the floor, on the solid floor, before we start to perform this CPR. Okay, and that is how we treat a heart attack. Now, I do want to break a few myths really quickly. I heard this myth about, it's called cough CPR, where some people believe that if you are having a heart attack, you should cough as hard as you can, and then you will still have blood in your brain for more time and it will ease the situation. I have to say, this is proven to be not correct. There's no such thing. Cough CPR is a really bad advice. Instead, our patient should focus on calming himself down and taking deep breaths instead of trying to cough really hard. And that is basically it. This is how we treat heart attacks. This is the difference between cardiac arrest and a heart attack. I hope you guys enjoyed this video. I had a fun time teaching it. And that's it. I hope you enjoyed, and I'll see you in the next one. Bye, guys.